Hi everyone, it's Krista from Aim at Skin Cancer. In today's quick clip, I thought I'd go over the three most common biopsy types. So let's start with, please don't laugh at me, this is a piece of skin. It's kind of like a layer cake. When you kind of take a piece of skin, look at it magnified on its side. The top layer is known as the epidermis. That's what we can feel. That's what we can feel here. Underneath, the second layer of skin is known as the dermis. And I didn't draw it, but in it are the blood vessels and hair follicles, that type of thing. The lowest part is called subcutaneous tissue, and that's really the fat, the very deepest level of the skin. When you go in to have a biopsy, there are generally three different types. One is known as a shave biopsy, an incisional biopsy, an excisional. So I'm going to attempt to show you what they're going to look like. Generally, a shave biopsy is simply shaving with a little razor. It's almost like this little bendy razor or a scalpel. The provider will just kind of shave off a spot on the top of your skin and send that to the pathologist. So a shave biopsy may look something like this, where they're scooping out or shaving off a piece of the top layer of skin. The incisional biopsy is also known as a punch biopsy, and they use a little tool that's kind of like a hollowed out pencil to just get a piece of the skin, and generally it's incisional or down. So the incision may end up looking like this. Okay, so they're taking a piece out, then they send that to the pathology lab to have it looked at under the microscope. Now there are different sizes of punches. They're tiny, so 2 millimeters, 3 millimeters, 4 millimeters, all the way up to 10 millimeters. And just to give you perspective, 6 millimeters is a pencil eraser. So they can be of various sizes depending on what they're trying to get within the biopsy. The last kind is known as an excisional, and that's generally kind of a little bit of a bigger deal, where they will generally excise or remove the lesion, and sometimes it requires sutures to close it up. So it's almost in what we call an elliptical shape, and the reason for that is let me just get my pen, so that when it's removed, those two pieces of skin can then be pulled together with stitches. So they'll stitch this closed, and the result will be a scar that's linear, that looks like a line. So for an excisional biopsy, that would look a little bit kind of hard to do that, but it's basically taking that piece out, and then it would be stitched so that at the end, when healing is done, it will just look like a line. You've all seen a scar. And so the scar will be just very, very linear. These biopsies are done to diagnose a skin lesion, like a skin cancer, or sometimes a biopsy will be taken so that they can look at something under the microscope, like a biopsy of a rash. So depending on what the provider is concerned about will often determine the type of biopsy that's done. For the shave or the scoop biopsy, doesn't require stitches. For the incisional, depending on the size of the punch, it may or may not require sutures. And if they did need sutures, then they'll be sutured kind of at the top here like this, perhaps a little bit more underneath. It really depends on the size. But your body will heal this biopsy site, and eventually that will get filled in by normal skin. So you won't have a divot. It'll just be filled in with normal skin. That can take a couple of weeks. So I hope you found this helpful. Please stay tuned for more videos and check out our website at aimatskincancer.com. Thanks. Bye-bye.